Hi, welcome everyone, and thank you so much for tuning in today for this timely and incredibly important topic. My name is Martha Rabur, and I am the Executive Director of the Shot at Life campaign at the UN Foundation. So we have been reading in the news about climate change. We know that as I am speaking and you are all tuned in, many are gathered in Glasgow to talk about this. But I think what we're going to delve into today is the effects of climate change on our health. So we've been hearing for years about increased respiratory and heart disease, but now we hear about things like low sperm counts in men, sharks getting in new waters, attacking surfers, as well as an increase of diseases spread by animals such as malaria, SARS, and COVID that have all seen an increase due to climate change. So thankfully, we have a really exciting webinar today with three great panelists that are going to take us through not only the effects of climate change on health, but more importantly, what we can each do about it. So as I said, right now, people are meeting in Glasgow at COP26, and that's really to accelerate the goals that were already agreed upon on the Paris Agreement. And my colleague Ryan is going to take you through a little bit more about that, what to look for and what to expect. And each panelist is going to give you a brief presentation. After the presentations, we'll have a panel discussion where you'll have an opportunity to ask your questions. So get those questions ready. We really do want to be able to have this be engaging and interactive. And then finally, my colleague Rebecca Maxey is going to talk to you about how you can use your voice to advocate for better climate and health policies. So there are many opportunities to get involved with advocacy efforts through the UN Foundation campaigns, and we really hope you'll take part and make a difference. So now onto the panelist intros. We are honored to have three inspiring panelists joining us today. First, we have my colleague, Ryan Hobart. Ryan is the Managing Director of Energy, Climate, and the Environment here at the UN Foundation. He's been at UNF for the past 14 years. And before his time at UNF, he worked for the United Nations Environment Program. Next, we have Kian Rostamazad. Kian graduated from Northeast University in 2020, and he is a Global Goals Ambassador for Sustainable Development Goal number 13, focused on climate. He is a climate activist, and he's joining us from Glasgow. Finally, we'll hear from my colleague, Tara Bracken. Tara is the Senior Malaria Advocacy and Communications Officer at the UN Foundation, where she works closely with the Nothing But Nets campaign. She has a bachelor's degree from the University of Virginia and earned her PhD in infectious diseases from the University of Georgia. Before I turn it over to the panelists, I want to give a very brief background on climate change, global health, and a little bit of how the Shot at Life campaign is working on these issues. So next slide, please. SDGs. So I'm sure many of you are familiar with the Sustainable Development Goals. Hopefully this is a graphic that you recognize. To summarize, these are a collection of 17 interlinked global goals, which are designed to be a blueprint to achieve a better and more sustainable future for all. They were adopted by the United Nations in 2015 after more than a year of consultations with citizens, companies, civil society organizations, and governments. So today, we're going to talk about the interconnection of SDG 3, which is good health and well-being, and SDG 13, climate action. Slide 4, please. So SDG 3 focuses on good health and well-being, and the goal is to ensure healthy lives and promote well-being for all at all ages. So we know that in order to achieve SDG 3, we need to improve our global health security, access to health and health services, access to vaccines. SDG 13's main goal is to take urgent action to combat climate change and its impacts. So most of the targets under SDG 13 are related to cutting carbon emissions to limit global warming. So although these goals might not seem related at first, in fact, they are deeply connected. Climate change affects every aspect of our lives and particularly our health. So I think many environmental issues tend to get lumped under this term, and I want to make sure we're being very clear. Climate change includes changes to weather patterns, such as warming or extreme temperatures. And these changes will cause more frequent and more severe extreme weather events. So we used to just say global warming, but that's not completely accurate. So while the global temperature is rising, what we're finding is some parts of the world are actually getting colder. And what we've also come to recognize is that climate change, it is a change in climate. It is not that the globe is just warming up on its own. It's that climate change comes from human activity, and humans have had an enormous detrimental effect on the climate of our entire planet. A new report from the United Nations found that if we continue with our current policies and behaviors, global average temperatures will rise by 2.7 degrees Celsius. Now, this change may seem small, but that slight temperature increase would cause an increase in catastrophic extreme weather events like flooding, heat waves, droughts, sea level rising to bury cities and parts of countries. Next effect, please. Next slide, please. So we know that climate change is already having a significant impact on the health of millions of people. Millions of people die each year from air pollution, severe weather, diseases such as COVID, SARS, and malaria. And we know that death rates will continue to climb as the global temperatures rise. So many people, it's important to talk to that people are being displaced from their homes. And there's a whole new category of refugees that are climate refugees. They're no longer able, for instance, to work the land. There's a drought situation, there are many reasons. So this results in overcrowded urban spaces. And we know that disease spreads more quickly when people are more densely populated. And this also results in people moving across borders and creating political instability. And we know that there will be more instability as the number of refugees climb. So many issues that we're dealing with now will only be exacerbated as the planet continues to warm up. Next slide. So what can we learn from COVID-19? The COVID-19 pandemic, we like to say, it was a real test of global cooperation. And so far, particularly wealthy countries have not done so well in sharing. I think the pandemic has also laid bare the weaknesses in our global health systems, the importance of investing in strengthening health systems to be able to be more resilient. We saw a lot of weaknesses across health systems around the world. I think most importantly, though, the pandemic has showed us how interconnected our world is, and thus how critically important it is that we have global cooperation and coordination. It is only through the support of institutions such as the United Nations and the UN agency, the WHO, that we can begin to tackle complicated global issues such as pandemic and climate change. International institutions allow for the representation and participation by low-income countries. So these are countries that are often the least contributors to climate change, but they also bear most of the negative effects. And often they've been left out of conversations. It's critically important. We work through organizations like the UN, where all countries and all peoples are represented. Next slide, please. So the Intergovernmental Panel on Climate Change recently warned of catastrophic consequences if we do not take drastic measures to cut our emissions and slow climate change. The UN Secretary General called this report a code red for humanity. The world does not have the strong international programs, infrastructure, cooperation, and commitments we need to deal with these changes. Strengthening our multilateral institutions like the UN is one of the best ways to address climate change and global health issues at the international level. The UN and the WHO led the global responses to the COVID-19 pandemic, and they must be at the center of our response to climate change. Next slide, please. So how can we improve our response? You know, I would say we all have a responsibility and a role to play. If it's the US government, international governments, the private sector, and individuals, we all must make stronger commitments. We need robust funding for global health security programs. And, you know, I think it's important to look at the graph and see right now, only 1% of the US federal budget is spent on foreign affairs. Only 1%. It is literally a drop in the bucket. And of that 1%, there's only 20% that goes towards global health. So when we advocate and we ask for more robust funding, and maybe you'll hear from others, why should we help people around the world, or we can't spend on international, we have so many domestic problems. This is a tiny fraction of the federal government's budget. Next slide, please. So at Shot at Life and at the UN Foundation, we educate people about climate change, about global health security, and how interconnected we all are so that we can advocate together. Shot at Life advocates for global immunization programs, but so much of our work is supporting many other health, development, and climate initiatives. We are really proud to partner with the World Health Organization, UNICEF, Gavi, the Vaccine Alliance, USAID, and the CDC to promote global health programs around the world and provide support to those who need it most. So that's a little bit about what we do at Shot at Life. Now I'd really like to turn it over to my colleague, Ryan Hobart, who's going to give you a preview of what to look for at Glasgow. Thank you.
Thanks, Martha. Great to be with you this morning. Again, I'm Ryan Hobart. I'm with the climate team at the UN Foundation. And I'll just say a few words. Martha has said a lot. I'll just emphasize a few points. And as she said, this is critical because COP26, the UN Climate Conference on Climate, is just starting today and will be going on for the next couple of weeks. Coming off the G20 meetings that you may have read about in the paper over the weekend, there are going to be lots of different discussions, both on technical issues around how to wrap up the Paris Rulebook, which is essentially all the rules to make the Paris Agreement that was agreed in 2015 work, to what kind of financing should developed countries provide to developing countries, and all kinds of other issues as well, including health. So let me just go through a couple ways that I think the intersection of climate and health is really critical. So the first one, I think that people might not realize, is that the health frame has been really important in terms of climate advocacy. Health is one of the things that people can identify with, and if an expert tells them not that climate change is just some distant threat to their grandchildren, but is something that is going to affect their health now, that's something they're going to pay attention to. And so that's why when Gina McCarthy, who's now the climate coordinator in the US government, which is a new position under Biden, when she was the head of the Environmental Protection Agency, she would always say, we're essentially doing health work here. When we're reducing emissions, we're preventing damages to people's health. immediately and into the future. It's also why the Chinese government, I think in part, has been ambitious in what it's done on climate change. If you went to Beijing 10 or 15 years ago, or Shanghai, you would be in a very polluted city where you couldn't see very far, and where the health impacts were really damaging. And that was a very visible way in which people understood that climate change and the power plants and things associated with climate change were impacting people's health. That has changed. It's not completely solved, but in advocating for better air quality, some of these cities which used to have worse air quality are getting better air quality. And in the meantime, we're starting to deal with climate change. That was true with LA. I think the hope is that it'll be true in places like New Delhi in the near future. The second point is that dealing with healthcare and climate change in conjunction is about justice. We know that climate change is going to impact the most vulnerable in a disproportionate way, even though they've been the least, they've contributed the least to climate change and have the least amount of emissions. And so if we care about the people who have the least to do with this problem, we need to be advocating for them. We need to be raising their voice, and they need to be heard. When a low-lying island is disappearing because of sea level rise, it's almost tautological to talk about that as a health impact. They're going to have to be, some of them are going to have very direct impacts on their lives, and ultimately some may have to be, moved to some other part of the world that doesn't, where sea level isn't as much of an issue. You think about the number of people that are dependent on fishing for their livelihoods, or the smallholder farmers who are dependent on the land and rain-fed agriculture to feed their families. Those are all people who are going to be affected by climate change. Their health is going to be compromised, and they've done very little or nothing to contribute to the problem. So showing health impacts is a way of pointing out that climate change is about justice for those who are still living in poverty. And then there are all kinds of indirect impacts that we're only just starting to understand and unpack. And one of those we'll talk a little bit more about, but is a mental health crisis that's related to particularly young people starting to think about what their future is going to look like if we don't do something about climate change. And so that's a downstream impact of climate change in the realm of mental health that we have to grapple with. Let's talk quickly about solutions. One of the things you're going to hear a lot about in Glasgow this week and next is the kinds of things that we can do to solve this problem. And obviously, the number one thing that we have to do is we have to reduce emissions of greenhouse gases, primarily from energy, but from a lot of other sources as well. And that's what the countries are there to talk about. But we can also find solutions in particular sectors, and that applies to the health sector. So WHO just strengthened its guidelines for air quality in September, saying that almost 80% of deaths related to PM 2.5 pollution, which is mostly due to fossil fuel burning, would be avoided if all countries followed those guidelines. So that can be a powerful way in which the health sector and people working on climate can work together. Then there's the health sector's emissions themselves. It's estimated that health facilities around the world emit about 5% of global emissions. And so there's several initiatives underway to tackle those emissions in the health sector and to try to improve that track record so that our society as a whole in the economy, in our overall economy, is reducing emissions at a rapid clip so that we can avoid the worst impacts of climate change. I'll leave it at that. I welcome a healthy discussion, and I know we'll hear more about all these issues from other panelists. So thank you.
All right. Thank you for the pivot, and I appreciate the comments from Ryan actually preceding this segment, because I think it's going to transition very smoothly. I first want to say hello and share that, yes, I am here right now at COP26 in Glasgow. I apologize in advance if you hear some noise back and forth, but actually I'll note that President Biden was just passing here a few moments ago, and probably will be back soon, and I think that's gotten a lot of people excited. But I'll say, in my role, as was mentioned, as the Global Goals Ambassador for SDG 13, I'm really thinking critically about how the problems and the challenges that young people are facing, particularly in climate action, is going to intersect with the modern day challenges that we face elsewhere. And so I couldn't think of a better area to talk about than the intersection of climate change and global health. Particularly, what I want to talk about today is an area that Ryan mentioned that I believe is getting more attention, but had been previously not paid attention to as we got into the topic of climate change, and that's the impact of climate change on mental health. Increasingly, as I'll share with some statistics, we're noticing that mental health is becoming very important and also very significantly impacted by the onset of climate change and also the anxiety about climate change. So I'll talk about eco-anxiety if we can move to the next slide. So we call this climate change induced stress. There's no question that the topic of climate change has become at times toxic in social media spaces, and you've seen an uptick, especially before, during, and after conferences, of fear of the outcomes, of frustration with inaction, of people getting fed up with the status quo. But part of that also involves people getting very frustrated. And social media, as we know, is not the best place to bring out our most excited nature, but unfortunately at times can spiral us into doom scrolling or all the other terms we use. So when asked about how climate change is affecting their mental health, 48% of Americans said that climate change is already impacting their mental health, which is a staggering statistic. To think that a topic which was not getting much attention decades ago, or even a decade ago just from this year, is impacting 1/2 of Americans' mental health. That's a very significant statistic. So if we move to the next slide. Let's look a bit deeper, specifically among young people. Young people, as you've seen, have taken the mantle when it comes to advocacy around the issue of climate action, but also they've taken the burden of anxiety around climate change, and that shows in the data. A really strong paper just came out by a number of researchers who were looking into how young people felt about climate change. And as you can see, 27% felt extremely worried and 32% felt very worried. Over half of young people surveyed were at least very worried. And you reach 75% when you count moderately worried about climate change. To think that this entire generation is facing that sense of worry or doom constantly can have a significant toll on a young child's brain development, can have a toll on their mental health, particularly at a moment where they're learning about themselves, they're forming their own perspective on life. And if you think of the adjectives that they use to describe, sad, afraid, anxious, angry, powerless, these are really strong and disheartening adjectives to describe how climate change is making a young person feel, which is really encompassing this term that we use, eco-anxiety. If you go to the next slide. Another thing to consider is the intersectional impacts of climate change and mental health, particularly among women. So when we think about young women, young teenagers who are being impacted by climate change on their mental health, I want to look at a number of factors that we already know to be intersectionally impacted by climate change. We know that climate change is disproportionately impacting women in a number of ways. The first way being the ways of life, the structure in family units, the methods of supply gathering and daily life in many countries is led by women who are facing climate disasters, who are facing floods, who are facing all these types of natural disasters as barriers and potentially very harmful, dangerous situations in their daily activities. That's disproportionately impacting them. If we go to the next slide. Another way to think about it as well is information gathered by UNDP about displacement, another form of climate impact that we're seeing increasingly in islands and in places that face natural disaster. UNDP found that an estimated 80% of people displaced by climate change were women. That's staggering. That statistically shows the significant impact and life-changing impact of climate change that's disproportionately impacting women. These are all factors that really highlight how climate change can at scale produce very, very broad disparities in outcomes for men and women, and for all different intersectional lenses of climate change. So considering that, if we move to the next slide, you have to think about other forces and how they're impacting women as well. As you'll see, global mental health trends are also disproportionately impacting women in ways that climate change may be disproportionately impacting women. So we go to the next slide. This is one study, one source of data, but there are many out there that highlight the disproportionate impact, particularly in categories of mental health challenges such as depression. Now, it might not show on the slide, but you can see on the axes. On the left, you have the prevalence of depression in males, and on the y-axis. And on the x-axis, what you don't see is prevalence in females. And so, if you look at the just this source of data, you're seeing that significantly in other countries, women are facing a higher prevalence of depression. They're and across many countries. You can see the world average somewhere in the middle there, but that XY axis line would show if there was parity. So you can see there's a disparity already in some of the types of mental health challenges that individuals are facing that's felt more by women. If we move to the next slide. So I used those to give you a background about what young people are significantly facing, what women are significantly facing, and giving us a better sense of what the mental health challenge is going to be and what eco-anxiety is going to do. If we take a formulaic approach and if we look at these factors, eco-anxiety is really built upon this impact in your ecological factors, having higher risk factors for ecological impact from climate change, and additionally having higher prevalence of depression and other forms of mental health significantly impacting you. That's a very tough recipe. And as mentioned again in the previous speaker's notes, this is something that is going to continue. And as the climate disaster gets worse, we can only anticipate that these challenges are going to get harder. And so we have to think differently about the way we're approaching both global health challenges and also climate challenges. If we move to the next slide. What are some things that we can do? There are many things we can do. As we'll see during the course of this conference, there are a myriad of challenges that we're facing when it comes to the climate crisis. But if we want to tackle it from a global health perspective, and if we want to make sure that we're addressing this, we first need to acknowledge that there is a growing mental health challenge in this 21st century. We need to acknowledge the increased prevalence in the data that shows time and time again that many factors, including climate change, are increasing the prevalence of mental health challenges and making life harder and making dealing with these problems much more challenging. What we also need to do is acknowledge some of these disparities that I've highlighted just a few of. The gender disparity in mental health challenges and how we need to tackle that. The disparity in facing eco-anxiety, and also the disparity when it comes to the challenges that youth are facing when it comes to climate change, as opposed to what other adults are facing because of this increased sense of burden for generations ahead. So when we take that information, we need to then use that to deliver more nuanced health solutions that tackle the most pressing global health challenges of our day, these challenges that the organizations participating today are really going after, but also finding ways to incorporate challenges that we didn't previously consider, like mental health and eco-anxiety, as part of the solution. And finally, something that I really think we need to focus on when we're talking about COP is improving the representation of women and of other groups in climate and health discussions. I actually saw an interesting statistic just today to inform this point, which is that when it comes to the COP plenary sessions, the opening statements, one study showed that 74% of that speaking time is dominated by men in that space. That's a challenging statistic. To not have a level of representation, to not have a voice in these negotiations, can contribute to a lack of a lack of capacity to create solutions that are affecting those groups that I mentioned. So we really do need to tackle the representation and climate discussions and health discussions. These are just a few solutions. I'll close by saying that this is a new area that we need to talk about, and you'll see young people leading these discussions every day, activists from Greta Thunberg to those who you may not recognize already. But we do need to remember that the climate crisis is an incremental challenge that we need to conquer, and it also is even more nuanced than just the nuances of climate change and global health. So we need to go hand in hand with as many groups as possible, as many intersectional ways to look at this problem. And hopefully through that, we're able to include everybody in the solution and make sure that nobody is left behind and no challenge is left unsolved. So I'll close there. I want to thank you for the opportunity to introduce that topic. And I'll say that I talk about many other climate issues, so I'm happy to connect, and I'll put my information in the chat if you want to follow along with what I'm covering from the climate conference on my social media and elsewhere. So I'll kick it back.
Hey everyone, I think I'm up next. Thank you so much for the opportunity to talk with you today about climate and malaria. I want to just start off by saying that while I'm going to focus on malaria today, I just want to remind everyone that climate and infectious diseases are really intimately connected. So a lot of the issues that I'm going to bring up today related to malaria can also be applied to a lot of other infectious diseases that impact the developing world. So that ranges from those that can be transmitted by insects like mosquitoes, so like malaria or yellow fever, but also spreads to ones that you wouldn't normally think of. So for example, conditions will be better for cholera to spread, or any infectious diseases that thrive in displacement settings, so tuberculosis or waterborne diseases, for example. But today we're focusing on malaria. So just a quick rundown of what is malaria? Why are we talking about it? Why does it matter for these development conversations? Well, malaria is a bloodborne single-celled parasite that's transmitted by mosquitoes. It's primarily found in tropical and subtropical regions, and it impacts a lot of people every year. In 2019 alone, we had 229 million new malaria infections and 409,000 malaria deaths, about 2/3 of which were in children under 5 in sub-Saharan Africa. Vulnerable populations really bear the worst brunt of this disease, particularly children under 5 years old and pregnant women. And it is a highly climate sensitive disease, mostly due to the life cycles of not just the parasite, but also the mosquito that carries it. Malaria is really sensitive to rainfall, humidity, and in particular temperature. So in some regions where you have the right conditions, rainfall, temperature, humidity, you can find malaria being spread year round, or in some places it's more seasonal. So you'll see it spiking in the warmer, rainier months, and then it might fade away for the colder or drier months. So what are the typical symptoms of malaria? It can lead to fevers, anemia, damage to internal organs like your liver, your lungs, your spleen. In pregnant women, it can lead to pregnancy loss or babies being born too small or too early. And especially in children under 5, you can have long-term neurological and cognitive impacts that can affect their development. It can affect a child's educational attainment. So the impacts of malaria are really serious in a lot of the developing world. Can you go to the next slide, please? How can climate change affect the global burden of malaria? You don't typically think of climate change as impacting infectious diseases, but like I said, they're really closely tied. Two of the main areas that I'm not going to talk about today, but I'll just mention very quickly right now. Food insecurity actually impacts malaria and vice versa. When people are more malnourished, they're more susceptible to severe malaria disease. And in particular, in young children and pregnant women, when they have severe malaria, they can become malnourished. Compound that with some of the food insecurity issues that we're facing due to drought or warmer climates, reducing the yield potential of some of our staple crops like maize, winter wheat, soybean, rice. You're going to have a lot more severe malaria disease in some of these vulnerable populations. And there are severe economic impacts of malaria. It's a disease of poverty. It puts people in poverty by causing them to miss work days, miss school days, leading to lower income and educational attainment. And vice versa, when you have less access to good education, good healthcare, you're going to be more susceptible to malaria. And that leaves a lot of these developing countries less able to handle some of the economic risks facing populations due to climate change. But the two that I'm really going to focus on today are expanding ranges of the mosquitoes that carry malaria due to climate changes and shifts in temperature and rainfall, and then all of the issues that are caused by extreme weather and the displacement that results from it. So as you can see on this slide, rising temperatures and changing rainfall patterns are going to shift where and when we see malaria being transmitted. In some cases, it's going to increase in some populations, and others it's going to decrease. But primarily, we're going to see an increase and an expansion of where these mosquitoes can be found. So in these maps, this is a map of Nigeria, which accounts for more than a quarter of global malaria cases and deaths just in this one country. And in these maps, basically blue, not too many mosquitoes that can carry malaria. Yellow, orange, red, lots of these mosquitoes that can carry malaria. Regardless of what we do in the next several decades, if we're able to keep emissions low, we're going to see some increase in where these mosquitoes can be found, but they're not really going to explode. But as you can see to the far right, if we can't keep our emissions under control, you're going to have places like Nigeria where you have really high, really intense malaria transmission, having these mosquitoes virtually everywhere. And if you can go to the next slide, you're going to see that that has a serious impact on when and where we can find malaria and how often it's transmitted. So in this map, the more and darker red is the more people that you see being exposed to malaria and for longer periods of time. So remember I mentioned that in some places you can have malaria be transmitted year round, and sometimes it's more seasonal, just for maybe 2 or 3 months out of the year. Well, the darker red you see here, the longer those seasons are. So now you have several more months where people can be exposed, and bigger ranges, geographic ranges where people are at risk. So what does that mean long term? You know, there's the obvious, more people at risk of malaria, more people getting malaria. That's obviously bad, but it's even more complicated than that, because with these shifting ranges, now we're shifting places where we can expect malaria to be. Typically, we can pinpoint a few locations where we need to prioritize all of our resources, our bed nets, our insecticide spraying, our anti-malarial treatments. Those are going to change. And if we're not paying attention to how it's changing, it's going to be really hard to get our limited resources to where we need them to be. And then on top of that, in places where you have a lot of malaria, adults are typically at risk of malaria, but it's not quite the same as in children or pregnant women. Over their lifetime, they have several malaria infections and they build up partial immunity to the disease. If you have malaria spreading into new areas that haven't really seen malaria before, even adults now are at greater risk because they don't have that partial immunity. And so now we're going to also have to change our strategies of how we fight malaria. We can't just focus on small children anymore. We can't just focus on pregnant women. Now we need to consider an entire population. And so we're going to have to do new research to figure out what are our best strategies for cutting malaria transmission in these new areas. So it's really complicated, and it's going to pose a lot of problems for our fight against malaria. Can you go to the next slide, please? So the other major issue is the connection between malaria and displacement. We're seeing an increase in intensity and frequency of extreme weather events, and that's going to lead to a surge in malaria transmission. Many extreme weather events, so hurricanes, flooding, heavy rainfall, exacerbate our risk factors for malaria infection. First, you can have some standing water caused by rainfall, receding floods that create great breeding sites for mosquitoes. Mosquitoes love breeding in shallow puddles and pools. And if you have more breeding sites for mosquitoes, you're going to have more mosquitoes. You have more mosquitoes, you have more people getting bitten by those mosquitoes and more transmission of malaria. Adding to that, when you have increased humidity following some of these extreme events, you can extend the lifespan of these adult mosquitoes, which gives more time for the malaria parasite to grow and develop in them. And that lengthens the season of when malaria can be transmitted. Usually the lag time between flooding and heavy rainfall and the onset of a malaria outbreak, if we don't intervene, is about 4 to 8 weeks. It's just inevitable in these areas where you have a lot of malaria transmission. Could you go to the next slide, please? In addition, when you have these extreme weather events, a lot of people end up losing their homes and getting displaced. Displacement in general, whether it's weather-related, conflict-related, it creates a lot of challenges for the fight against malaria. It disrupts health systems, so any access people already have to malaria services are disrupted. It displaces health workers and field staff who know how to handle malaria, and so we lose a lot of that expertise. It puts a lot of people in a high risk, high exposure setting, so they're living in temporary shelters as opposed to solid buildings where mosquitoes can't get in. They may not have access to their bed nets that they would have at home, and so they're sleeping exposed to all of these mosquitoes. They're living concentrated, and potentially people are coming from different areas. You might have people moving from an area where there's a lot of malaria to an area with a little bit of malaria, and they're taking it with them, or vice versa. They're from a place where they don't know what malaria is, and they're going to a place where they have a lot of malaria. And it also makes all kinds of logistical challenges. Now we don't know necessarily where people are, how many bed nets and how many treatments and diagnostic tests we need to get to specific areas. And we have to consider that when you have a displaced population entering a community, you can't just serve that one population. You also have to consider their hosts who live around them. And that can create all kinds of logistical challenges with getting resources to people. Can we go to the next slide, please? In particular, as I said, vulnerable populations face increased malaria risk, but especially during displacement, we have pregnant women and young children being at the greatest risk of severe illness and death. That's due to all of the usual problems. There's specific versions of malaria that happen in these populations that are more severe, but you also have increased risk of neonatal death, maternal death, under 5 deaths in settings of conflict, displacement, and natural disasters. Malaria causes an estimated 16% of deaths in refugee children younger than 5 years of age. And we have an additional complication where displaced women and girls receive less antenatal care and are exposed to more violence, malnutrition, poor hygienic conditions, and communicable diseases, putting them at increased risk of malaria in pregnancy. What are our opportunities to act? What can we do to mitigate some of these impacts that we see of climate change on malaria? Well, really, we need to work between sectors. Just working within the health sector is not going to be sufficient. We need to coordinate our surveillance system. So we're checking all the time to see, where do we see malaria? Where is it being transmitted? How severe is it? If we can take those data and loop them in with severe weather early warning systems, we can identify places that are at particular risk of malaria should an extreme weather event hit that area. We also need to integrate malaria into disaster response plans. If you know ahead of time that malaria is going to potentially be a problem, you can coordinate with humanitarian agencies, with environmental partners, and make sure that you're putting that into your plan when you're creating resources and creating plans for how you're going to respond to any of these extreme weather events. In general, a lot of what we're going to have to do is multi-sectoral research, multi-sectoral collaboration, so we can come up with better forecasting and know how our long-term plans for malaria elimination are going to be impacted by these expanding vector ranges, by these increased extreme weather events. And vice versa, how can we potentially advocate for malaria to increase development and maybe reduce emissions in some of these places where, frankly, they're not contributing for the most part to climate change, but it couldn't hurt. So I think that's all I had to talk about today. But thank you so much for the opportunity to highlight some of these key areas, and I'm happy to answer any further questions.
Kian, can you see the chat?
You want me to tackle that one?
Yeah.
Right. So I'll just, for anyone that isn't reading the chat, the question is, if I think being a young person has contributed to my eco-anxiety, and if it's what got me so involved in the issue, and if not, when and how did I decide to focus on the climate? It's a great question. I actually decided to talk about eco-anxiety today, not because of my own. I consider myself to be really optimistic about the future of climate action because of what I've seen in the people I've met at past COP conferences, in the people who are the decision makers, and maybe not the most senior decision makers, but the people who are making choices along the way. I've really seen their ambition. I've forced myself to remain optimistic where I can, and I think it's paid off in seeing the positivity. But unfortunately, I've noticed that my peers in the space, other advocates, other people who are working in the climate space at nonprofits, those who are working in local governments, there has been a real uptick in eco-anxiety. And I think it does have to do with being a young person, because people are facing important questions such as, are they going to have children? When do they want to have children? These are questions that many people are having to think about, and maybe I won't age myself, but it's not quite soon for me. But eventually, those are questions that I might be having with a partner. And I know peers who have thought about that. And that's a really difficult question that you have to say, do I believe that the climate is going to be able to protect and maintain my family and my children? And to have that kind of a thought breeds a lot of anxiety. And so that's part of what has frustrated a lot of people and has led to that eco-anxiety. And there's many factors. But yeah, I personally remain optimistic, and I try to let that drive me. And I let others' eco-anxiety drive me to try and resolve that for them. Thanks.
Thanks, Kian. Ryan, I think you may have the next question from Susan Tyler, and if you can't read it in chat, I'd be happy to read it to you.
Thanks, I can see it. It looks
okay,
like
great.
It's about what the UN Foundation specifically supports.
Yeah, like does UNF have specific, right?
Yeah, so I guess there's two parts to that question. I mean, you raise cap and trade or carbon pricing, which I think is absolutely part of the solution. We're going to have to essentially, economists say it very simply. If you have, if you're doing something that's having what they call an externality in the broader economy, if there are costs that are being borne by actors who aren't creating the problem, you've got to shift where the costs are. So putting a tax on pollution, for example, is just a very obvious way not to treat the atmosphere like a greenhouse gas emission dump. So that's one of the policies. A number of countries have adopted that. There are different ways of doing it, and it gets very technical. But I do think that having an overarching system for our economies where the polluters are paying for their pollution is going to be important. That's been something that's been difficult in the US context from a policy perspective. We are looking at a massive infrastructure bill that might get finalized this week. We'll see. But it focuses more on incentivizing the right behavior. So it's tax credits for renewable energy companies, that kind of building out EV infrastructure, that kind of thing. As far as what the UN Foundation is doing specifically, we're working very closely with the UN on a lot of these issues. So working with the Secretary General of the UN, which, if you don't know, he's a huge climate champion. When he became Secretary General 5 years ago, we weren't certain that would be the case. And he's been one of the biggest champions that we could have. So that's fantastic. We work closely with his team. We work with the different agencies. We work closely with the Intergovernmental Panel on Climate Change, particularly in trying to disseminate knowledge around climate change and its impacts and solutions. And then we work on particular issues related to climate change. So I've been doing a lot of work on climate change in food recently. I think there's a new realization that food is both a big part of the problem, but is also a big part of the solution, particularly if you look at how we produce food, how we transport it, how we store it, how it gets distributed, but also then what the waste component of that is. How do we waste less food? Because that's a big cause of emissions as well. And then we also do work on things like ocean and climate change. So how do we get the shipping sector to reduce its emissions? And what are the impacts on the ocean? So a pretty broad range of issues, but totally agree with you on the carbon pricing and cap and trade aspect of this. We absolutely need to figure out how to reduce emissions by making polluters pay for their emissions.
Thanks, Ryan. I wanted to ask a quick question of Kian and Ryan, maybe starting with you, Kian. How worried should we be that Russia and China are not there? And sort of what's the buzz right now in Glasgow about the fact that those two major actors have decided not to travel? to Glasgow.
That is something that shocks people, and it did cause a lot of media attention to that. But I would actually say, personally, I'm not as concerned as I was at past COPs, the way that inaction was the theme of those conferences. So for some context, at COP25, there were a lot of deadlines that weren't met, particularly in really key areas like the Article 6 negotiations, which are talking about carbon markets and trading schemes that many countries were ducking. Those were more concerning to me than a country not being present, particularly because that opens the door for the countries that are present, especially if there are still leaders present, to make progress on their outcomes and then apply pressure afterwards. And so if you take a look at China's NDC, their nationally determined contribution, which they recently updated, they actually don't have a plan to get to net zero by 2050 the way other countries do. And so while some people might look at that in their absence and be frustrated, I actually look at that in their absence as being, it contributes more to our capacity to impact them, to say, you weren't at the conference and you also don't have this outcome. So I think there will be a bit of politicking with it. I'm sure the leaders are thinking about how they can apply pressure. We would have loved to have them there. I'm not saying it's a good outcome, but I don't see it as challenging as some others may find it, and I'm sure it's possible Ryan may see it in a different way.
No, I think that's right. And at this point, we're in there's such an ongoing conversation with all of these countries, that I think there's a lot of pressure from a lot of different sides. I mean, the question of whether the action that comes out of COP26 is strong enough is really going to have to do with expectations about what we want, what we think we're achieving. So will we bend the curve so that we're certain that we're going to stay under 1.5 degrees of warming? Probably not. That's going to take several more years and a lot of pressure on an ongoing basis. Have we already, at this point, made a lot of progress just in the last year in terms of what the US has announced, in terms of financial commitments, in terms of countries upgrading their nationally determined contributions, their climate pledges? Absolutely. And I remember, having done this for a little while, 10 or 15 years ago, we were looking at, 4 or 5 degrees of warming as a pretty certain trajectory. So to know that we're probably with the commitments we have in store, probably under 3 degrees of warming, which is not at all good, but is much better than 5 or 6. And that we could keep in sight, keeping emissions from rising more than 1.5 or 2 degrees is much better. And it shows that the sustained attention on this issue over the years is really bearing fruit. Now, there's a lot more to say about China in particular, and about Russia and their approach to these issues. It's very complicated, but I do think that just in the last 3 years, we've seen an incredible amount of attention to this issue. I mean, if thinking just a couple of years ago that a new, even Democratic president would come in and make climate change one of his very top issues is hard to imagine. So I think that progress is slowly being made, and we need to keep up the pressure, and that includes for countries who need to be doing a lot more at this point.
Thanks, Ryan. I see we just have a few minutes left, and I want to make sure my colleague Rebecca has a chance to present. So I know we're all available over email, and our emails can be shared with you, but I want to send it over to Rebecca.
Thank you, Martha, and thanks again to all of our panelists. It was so wonderful hearing from all of you. I learned some new information today as well. So thank you all for spending the time and for joining us, especially with your busy schedules going on. All of us here appreciate it, and for allowing us to record this so we can share this with more of our advocates. So, as we've heard today, as we've heard from all of our panelists, we've been able to cover how climate change is affecting global health. I would love to share some opportunities for you to get involved with the relevant advocacy campaigns here at UNF that you were able to hear from today. Of course, Shot at Life, UNA USA, and Nothing But Nets. We all rely on people like you that essentially advocate for our causes and use their voices to help advance them. So the best way to get involved with our campaigns is to become a champion. And what that essentially means is you'll be a trained advocate for these campaigns. We'll send information after this webinar is over. I want to make sure we end on time. So you will be getting an email full of information, but there's a lot of different ways that you can get involved with these campaigns, both as a champion or just a supporter. So you can see some of those here. We sign petitions in order to get emails into our members of Congress. We use social media to amplify those messages. We call Capitol Hill, we write letters to the editor, to our local papers, and we hold meetings all the time with our members of Congress. And so all of these actions combined really are helping to make a collective difference when we lobby to our members of Congress. And our campaigns have thousands of champions, and each one of them is making a difference in their own way in the actions that work for them. So we hope that you will join us in creating a better future in all of our campaigns. And now I'd like to move to some specific things that you can do today. So one of my colleagues will throw these petitions in the chat. Looks like they're already there. But this is how you can use your voice today, right now. Our different campaigns have 3 different asks. Each campaign has its own ask going on. And essentially you can sign this petition and it'll let your members of Congress know that you show support for our different causes. So Shot at Life specifically, we advocate for global vaccination programs. As Martha mentioned, you will, that's things like Gavi, the Vaccine Alliance, UNICEF, WHO, great programs like that. So if you would like to sign our petition, that really, during this time as we lead up to World Pneumonia Day, that will really make the difference. Nothing But Nets is calling for robust funding for the President's Malaria Initiative, the Global Fund, and UN agencies. So I would encourage you to check out that petition as well. And then our last one is from UNA USA, asking our members of Congress to prioritize policies that support a healthier planet and a more sustainable future. So I encourage you to take a few minutes to click on these petitions, get involved with all of our campaigns, any of our campaigns, dip your toe if you've never done advocacy before. We will be sending up follow-up information to everyone here and allowing you to watch the recording if you'd like to get any more information out of that. But again, thank you so much for joining us today. We will send this information and hope to see you involved in some of our advocacy. So just thanks again to all of our panelists and for our attendees for joining us today. And I'll let you get back to the rest of your Mondays. Thank you so much.